afternoon and thanks for joining us. I'm Judy Simpson. Today we feature another segment of our ongoing series with the Vermont Cancer Center at the University of Vermont and Fletcher Allen Healthcare. For years, cancer survivors have been frustrated by the mental cloudiness they sometimes notice before, during, or after cancer treatment. Even though its exact cause is not always known, this mental fog is commonly called chemo brain. Well, today we're going to learn more about this condition and what can be done to help those who suffer from it. Joining me are two experts from the Cancer Center and UVM's College of Medicine. Dr. Patty O'Brien specializes in internal medicine and cancer survivor issues. Patty is joined by Julie Dumas. Julie is an associate professor of psychiatry. Her research focuses on how cancer, chemotherapy, and aging affect the brain. Thanks so much for being with us.
Thank you. Thanks for having us.
Now, Patty, you're in a unique position to help us understand chemo brain because, of course, you're a doctor, but you're also a cancer survivor who's experienced chemo brain. So what is it?
So chemo brain is not a word that I learned from medical professionals or in medical school. I remember the first time I heard the word chemo brain, I was sitting in my kitchen with another cancer survivor, Ev Grimes, and I was burning kids' dinners because I was like not able to talk to her and multitask and, you know, get things ready for dinner. And she goes, "Oh, Patty, you have chemo brain." I was like, "Oh, chemo brain." So chemo brain is a word that is used very casually within the cancer community. People will joke about it, you know, "Oh, I've got chemo brain." But it's a word that can mean very different things to people with cancer and to their healthcare providers. So it's a very non-specific term that people use to mean some kind of memory disorder. The technical term is neurocognitive dysfunction, but you don't hear that. People don't say, "Oh, I have neurocognitive."
Because you couldn't remember that.
Right. It's too much of a mouthful. So people will just say, "I think I have chemo brain." And to some people that may mean a very minor little, "Oh, I forgot something." And to other people, it's very upsetting to them and they really feel like something is frightening to them.
And so it's an umbrella term,
Yes.
But it's real. I mean, this is not an imagination.
No.
It is real. And from a research perspective, we hear about chemo brain, which implies that you have this memory dysfunction after chemotherapy, but we also see it after other sorts of cancer treatments, so maybe radiation or surgery with anesthesia or some hormone medications you might take to treat your cancer can also affect your memory and cognitive functioning. So chemo brain is a nice, easy term, but it also affects other people who maybe haven't had chemotherapy. So there's other ways to sort of have this memory dysfunction, and we're trying to figure out what we can learn about how each of these things affects people's memory.
So as we were talking earlier, and my mother had open heart surgery, and she experienced memory loss after that.
Yes.
And so I guess, is this something sort of new to study for doctors? I mean, the focus is on the cancer and the body, but then reaction to that and other reactions to some of the treatments, is that sort of new to kind of look at?
Well, I mean, I think the whole field of cancer survivorship is, again, relatively new in that we're lucky we got a lot of cancer survivors. I mean, before you always just were like, we got to find cures, we got to find cures. And great, we found cures. There's, 13 million people in the United States who have survived their cancer. And now they're really trying to fine-tune the long-term side effects that people have and the short-term side effects that people have and see if they can prevent them, treat them better, give people a better idea of, how your memory is going to come back. And so it's not new. I mean, people have been researching this for 20 years, but it's a much hotter issue, and people are fine-tuning the knowledge about it better.
Right, and I think it's a great thing that we have so many survivors and we get to study or get to figure out how we can help them live more active lives.
Let's talk about why someone who's being treated for cancer might develop some problems with their memory.
Sure. The first thing is you get the diagnosis of cancer, you're immediately stressed out. I mean, it doesn't matter that you may have a cancer that's 100% curable or 99% curable. You're still stressed out because
it's a scary word.
It's a scary word. And then many people become depressed around the fact that they've got to go through these treatments. There may be, lots of changes in their life with it. You tend to get a lot of medications associated with treating it, so sometimes it's a side effect of the different medications, so that you don't have nausea. With some of the cancer drugs, you're given a lot of steroids, and steroids can cause sleep disorders, they can cause mental, psych changes, and then you withdraw the steroids, which can cause problems. You don't sleep at night, you may have had surgery or have some local pain related to the cancer, and your hormones may be all over the place. So for many, many women, they go into menopause because of it. So, and in men with prostate cancer, we may give them some hormonal manipulation. So there's lots of reasons your brain may not be processing things quite the way it used to. Many of those are going to be short-term changes. You're going to get off the steroids, you're going to get off some of these medications. So, but everything may happen all at once. So you may have difficulty processing.
It's like someone takes your body and just shakes it up.
Oh, yeah.
Absolutely.
And so, Julie, can you sort of define some of the functions then?
Sure. So probably the thing that people notice most might be some memory or attention difficulty. So perhaps, what did I come in this room to get? Where did I put my keys? I came to the store and I had a list, but I forgot it. And what am I here to get? So those
I'm used to that.
Right, exactly. That happens to everybody. It certainly happens more as we all get older. So that happens to everybody. And I think those things become perhaps more frequent or more consistent with cancer diagnosis and cancer treatment. There's also things like attention, sticking to it, starting a task and sticking to it, or even maybe doing some math in your head, those sorts of things. And those are, as we were joking, these things happen with aging, and they also happen with under stress situations, under medication. And luckily, we can do things to treat depression or anxiety and maybe lower stress, even some exercise, some yoga, things like that. However, these memory and attention problems still remain. So the one thing we really look at is, are you having difficulty doing everyday activities? That's sort of the big indicator. So, we all forget people's names, perhaps someone you just met, or you might forget something at the store, but it's when you are having difficulty at work doing sort of normal activities, or maybe forgetting other, sort of things you would normally be able to do and other people notice. So these are sort of big signs that maybe this is a little bit more than just we're all a little stressed out and busy, so we should.
Well, let's take it a step further. That's got to be incredibly frustrating, not only for the person, but for a spouse or kids and anybody around them.
Absolutely.
It was actually frightening for my husband that I was not as functional as I needed to be.
Well, burning dinner, that's traumatic.
I burned dinner for years, but I mean, I destroyed dinner.
So what can be done for patients with this concern?
So the first thing we want to try to treat are the things that we know how to treat. So depression, sleep problems, anxiety, those sorts of stress-related psychological things. We know how to treat, not perfect all the time, but we do know how to treat those things. And then once we have, we maybe get better rested or some medications, whatever's necessary, then we will assess, are there still cognitive problems? And sometimes there are. Something I haven't mentioned yet is it doesn't happen to everyone, and it happens to people in different ways. So we there are people called neuropsychologists who are able to do these cognitive assessments. They would give you a bunch of, can you remember this list of words? Can you draw a clock for me? Those sorts of things. And we can assess how you're doing based on what you should be doing for your age. And if there are some problems that are not, maybe not normal for your age and your education, then there are people to refer you to for further help, maybe a speech pathologist or an occupational therapist to help get some training with getting back to your normal functioning.
And so, that can be done. This can be something that can be worked on in exercise. I would imagine, is the brain kind of like any other muscle that might be atrophied after?
Absolutely. I say that all the time. The brain is like a muscle. There is a sort of use it or lose it kind of thing. So we talk about, as people get older, you want to keep doing crossword puzzles or keep active, keep learning new things. And that it also applies in a situation like this where you might have this temporary change after some medication or treatment or surgery. Just sort of keep active, keep your brain working, and then you hopefully can get back to where you started before.
So Patty, is this something that's discussed with patients before they undergo chemotherapy and to kind of warn them? Or
It is, but you also don't want to over-frighten
Right.
people. So you need to kind of warn people that you should have somebody there to drive you home from chemotherapy, but you don't want to say, oh, you're never going to be able to drive your car again, or people might not go for a cure. You know, so
Right.
there's a balancing act. You need to inform people of potential side effects, but not everybody's going to have them, but not do it in a way that just totally freaks people out, because some people don't go for curative cancer therapy because they're so afraid of side effects that they may never have. So yes, people do talk about it. There's pamphlets all around the clinic about it. But what we try to do is say to people, okay, after chemotherapy or after this procedure, we want you to have a family member or somebody who's going to drive you home, and then let's see how you feel. And you know, maybe you need to carry a cell phone with you so that when you feel really tired, you can call somebody and say, come get me because I'm feeling really tired.
you say rest is very important.
Oh, it's so
I mean, most
important.
of us normally don't get enough rest anyway, so
Yeah.
if you're used to that kind of a schedule, you really have to pull it back if you're undergoing chemo.
You do, and that's really hard for some people. I mean, it's really hard. I mean, I was a working mom before this, and I was used to multitasking, and I just wasn't good at saying, I need help. I was very bad at it. And I will never forget this. I really probably should not have been driving to radiation therapy every day. I was absolutely exhausted. I'd had a bone marrow transplant. I was really anemic. And I'd driven to Fletcher Allen a zillion times
Right.
from my house in
autopilot,
South Burlington. It was
probably.
autopilot.
Yeah.
But they had a special parking place for people in radiation because you were there every day for radiation. And I was going only about 5 miles an hour in the parking lot, just about ready to park my car. And a friend waved to me. And I couldn't coordinate waving and putting on the brake. And I literally drove my car into the building. So my car hit Fletcher Allen.
Fortunately, you weren't going fast.
I mean, nobody got injured.
Right.
You know, the bag didn't, pop open.
That's pretty scary.
The guard
Yeah,
came
scary.
over and was like, "Are you all right? Are you all right?" And he walked me into the radiation oncology department, and they're like, "You're okay." But I'd driven myself there, and I really should have admitted that I really wasn't quite. Nobody took my driver's license away from
Yeah,
me.
right.
And in retrospect, maybe they should have.
Let's take a look at the third slide that you brought, because this is really kind of interesting. Now explain what this is twins.
So these are two twin sisters who went through the same special type of MRI that measures how much of their brain is working. So the top three slides are the sister who was treated for breast cancer with chemotherapy. And then the bottom slide is her identical twin sister who did not have chemotherapy. And the first row going down is them doing simple math questions, and then the next row is them doing harder math questions, and then the last row going down is the most difficult questions. And if you compare how much of the bright yellow-orange is lit up, that refers to how much of their brain is working hard to answer these simple questions. So to the observer, it looks like the two twins are identical, and they're both answering all of the questions, and they get the right answers. But when you look at the slides, the amount of brain that's functioning is very different. The twin on the top, who's had the chemotherapy, more of her brain is lit up. She's using a lot more energy in her brain to answer that question. So it's just like she's using more muscle power. The question gets harder, more brain lights up. And at the end, she's really using a lot of brain to answer that difficult question.
Now we have about 15 seconds left, Patty. So what do you have to tell cancer patients and things that they should be doing?
They need to relax, listen to themselves. When they're tired, they need to lay down, take a rest, do little brain puzzles when you can, get out and exercise when you can. You got to just take care of yourself, and you're going to get through this.
Well, I want to thank you both for joining us today. That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.